It is a life that took him from West Point, one of Liberia's poorest slums, to some of America's leading universities.
This is where I used to live. My mom, my dad, and my sisters and I were all in one room.
Things were tough, and many times the family could not afford to send him to school.
Then the first time we couldn't afford and we didn't go to school.
When he did go to school in faraway Caldwell, he had to walk miles and miles to get home.
As a kid, 10-year-old kid, walking from Caldwell to West Point, probably 1 or 2 hours.
But he persevered, and with the aid of scholarships, graduated from high school and then the University of Liberia. Then, with the help of some friends, he made it to the United States for graduate school.
My parents couldn't afford it. My friends in America tried to raise my plane ticket. Someone would give $100, another person would give $50 to buy my plane ticket to go to the States. I went first to Kent State. I should have done a master's in 2 years, but I was so fast to learn, so I did it in 12 months. Then I went to University of Kentucky to do my medical school, do my PhD in microbiology and immunology. And then I got accepted to go to Harvard to do global health, and I did infectious disease epidemiology. So it's a long road from, now I want to cry in fact. It's a long road from here.
He returned home not too long before the Ebola outbreak that hit his very own West Point very hard.
When Ebola hit West Point, for me it was personal.
He plunged in, leading a contact tracing effort that was crucial to ending the disease in West Point and other parts of Liberia.
And I'm proud to say it's a result of our working in West Point, we were able to develop a system to control Ebola to the point that the minister, Dr. Dan, called us and said, what you've done in West Point, can you do in other places?
He then helped found and lead a national effort to study the impact of Ebola on survivors.
I'm the lead scientist in Liberia for the Ebola natural history study. Particularly want to understand among Ebola survivors, what are some of the medical complications they develop. So we're looking at them and we're going to follow them for 5 years. They come by every 6 months. This is the largest study in the history of the world.
He has also helped lead the effort to establish Liberia's Public Health Institute.
So when Ebola ended, the Deputy Minister of Health called me and said, I want you to help Liberia to set up the Public Health Institute. We wrote a strategic plan, operational plan. I'm happy to say that this going December, the House finally passed the bill, so the Senate passed the House. It's not going to be before the President to sign it. And what that will basically do is that we're going to put people together who will be able to detect diseases ahead of time and respond. And so we don't have our innocent people dying like what happened from Ebola.
But the thing he's most proud of is this: the Refuge Place Health Center that he helped build with his own funds while still a graduate student in the United States.
And my dad said, well, my last thing I want to do before I die is to ensure that all of you get land and build a house. I said, Papa, I don't want to build land and build my house. He said, what do you mean? I said, I want to build a clinic for the poor people. He's like, are you serious? I said, that's what I want to do. And I was a student then. I couldn't afford the money because I was living on the money they were paying me as a graduate assistant. So they would give me like $850 every 2 weeks. I would live on the $850 I would send it. And so I bought the land in Lower Johnsonville for the people. I bought the land and built a clinic. June 2014, we opened the clinic. We started first running as a free clinic in Ebola. I think we've treated pretty close to 20,000 people now. We have pretty close to 700 deliveries.
He is now helping residents of Low Cost Village just outside Bensonville to build a similar clinic. And the lesson he thinks we can learn from all of this is rather simple.
Working with the local people in our community to address their needs is the power that can change this country. Because the local people, they want the same thing I want. They want their children to be educated. They don't want their children to die. Nobody will want their child to die. They want their children to go to school and have a future. I show all the young people looking at me today want to be like me, want a success story too. So because they all want this, then we'll have one common thing. So my own thought is that we can do it all across villages and slums. We shouldn't write them off.
And it is for all of these reasons that Dr. Mosoka Fallah is our healthcare worker